right, good afternoon, everyone. My name's Danielle Manelli-Pagnotta, and I'm the Executive Director of Providence House, an organization that has worked with women re-entering from incarceration for over 40 years. So many of the sentiments today, we share them with our peers and with our colleagues. Since joining the organization in 2017, I have seen countless women come through our doors talking about the experience of violence that they have had within the walls of Rikers Island. Furthermore, we heard a lot about the people who have no access or can't get access to mental health treatment. So many times the women coming through our doors come misdiagnosed or lacking the medication that they need to stabilize. They come to us in crisis, and it causes us to scramble to be able to help them stabilize and move forward with their lives. It's just not right. Beyond that, we know that so many people, as we heard from the mother earlier, are sitting on Rikers just because they can't afford bail. Over 85% of the people on Rikers haven't even been convicted. We also know that on average, the people staying on Rikers will be there 110 days on average, but that number doubles when you have a mental health diagnosis. And that's, again, we're talking about people who have may or may not even committed a crime. And that's just completely unacceptable. The truth is nobody's getting the care that they need at Rikers. We need every tool available to help prevent people from going out there, to bring people home, and to help stabilize them once they're with us. At Providence House, we're focused on the 370 or so women and gender nonconforming folks who are out there. And this group presents a unique array of challenges when you talk about access to reproductive health care or gender responsive programming, even beyond just basic health care. Additionally, we work with mothers, and we know that the effects of incarceration for those families and the children who are left behind are even worse. So our call is to close Rikers for a more compassionate and equitable society. We have to provide alternatives to provide rehabilitation, healing, and reintegration of individuals into our communities. The answer is not investing in an institution that further traumatizes. Come on now. It's in investing in resources for programs that actually help people to rehabilitate. It's in investing in housing that helps welcome these people back into our communities. It's the ethical thing to do. It's the fiscally responsible thing to do, and it's the only real way to build a sustainable and effective public safety strategy for our great city. Thank you so much.
Yes, thank you so much. Providence House is doing amazing work in our city. It should be replicated. The city should be investing in that because they're helping the most vulnerable, marginalized people in our communities. So next up, I want to bring someone who not only works at, when we said CEO earlier, that's the Center for Employment Opportunities. Put your hands together for another member of Freedom Agenda, Dion Johnson.
Good morning, everybody.
Good morning.
My name is Dion Johnson, and I'm a member of Freedom Agenda. I'm also a survivor of Rikers Island. I'm here today to say that we cannot extend the torture of Rikers Island any longer. Rikers Island has already been open 90 years too long.
Exactly.
The mayor and his administration must take all necessary steps to comply with the legal and moral mandate to close Rikers by August 31st, 2027. The necessary steps I'm talking about include the following. Number one, substantially expanding funding for and the utilization of initiatives proven to reduce incarceration and increase community safety, including supportive housing, community-based mental health, and substance use treatment, pretrial diversion and alternative to incarceration programs, as well as reentry supports. Number two, expediting the construction process of borough-based jails following the original planned capacity and percentage of therapeutic units. Number three, permanently closing empty jails on Rikers, starting with the Anna M. Cross Center. And number four, immediately open the planned outposted therapeutic hospital units at Bellevue and expedite completion of the units at Will Hall and North Central Barracks. Listen, Rikers Island has an expiration date. Let's do what the law says, and let's make New York City a place where true public safety is our #1 priority. It's time to get stuff done. It's time to get Rikers closed. Thank you.